startup ready. I run a small digital health company based out of Oxford and London. It's called Resony. I was just saying, Shai, that for the first 3 to 4 years, I was standing there and there, and I got a seat once. I was sitting there, and I was wondering, I always wanted to pitch here, so I'm really grateful to be here. There are few familiar faces in the crowd, but I'm so pleased to be here. Even if the presentation doesn't go well, I'm really excited to be here. Thank you. Hello. You hear me? Yeah. So what I want to present to you is the relation between tech and mental health. We have a small innovation which is technology only, and which is different because for the past 100 years, mental health, what have we done? There are essentially two ways for the past 100 years to treat mental health conditions. First is to give them medication, and the second is to treat them with a clinician. The clinician comes in many forms, like a psychologist, a psychotherapist, a psychiatrist, or a coach, or maybe even a guru, but they're all healers. So what we have not done is using technology to treat people of mental health conditions. But we are at the first wave of innovation of using purely technology, and I'm not even going to talk what technology, because it could be anything. But this is the first wave, and we are pleased to be able to present one small innovation. Okay, I'm trying to figure out how to go next. So, as I mentioned, who needs the third place for mental health? And in mental health, we call them the missing middle, the people who do not benefit from the well-funded wellness apps like Calm and Headspace. That's on one side. And the other side is the public healthcare systems, like the NHS services, who are there in crisis. However, there's a significant proportion of what we call the missing middle in mental health who do not benefit and who fall through the tracks. And we believe that technology could be used for those people. So just some numbers of why we started this business 4 years ago. We wanted to impact 1 billion people worldwide. And out of the billion people, there are 400 million people worldwide just with anxiety disorder. And our initial focus on just with anxiety. And even within anxiety, we are focusing on a tiny portion of 5 million people called missing middle in mental health. And since mental health is a heavy presentation, it's a heavy topic, I didn't decide to bring anything, just slides with product features, 3 to 4 product features. What is our first product? It's called Anxiety. It's for adults to help them manage anxiety and generalized anxiety disorder. It could be available via GP prescription once we have built the pathways in the UK to prescribe apps, which we have not yet built, but we are on that path. Or you could get it directly via self-referral. So if you're a user who's suffering from anxiety, you could go to the App Store and download it directly. Now, safety-wise, I'll get to the safety because that's the next question which people ask. Quickly run you through the features. What happens when you download the app? There is an initial assessment, which is 7 questions. On an average, it takes 4 seconds for a user to answer their GAT-7 questionnaire. And this is the same questionnaire which a psychiatrist or a psychologist uses to diagnose a person. Once you do that, you will have a resonance breathing exercise. And the reason why we use resonance breathing instead of cognitive behavioral therapy is CBT is fantastic, it's evidence-based, but behavior change is incredibly difficult. So what we did is a simple stepwise approach. We first start the user with physiological exercises such as breathing and muscle relaxation and get the user from 0 to 1. And once the user is at 1, Then we give them digital CBT. So it's the same approach used by the NHS, and we have digitalized it. The next exercise, what they get is a gratitude journal. Again, most people really use it very simply in their home, wherever they are, in their offices. This one is my personal favorite. As an entrepreneur, I have so many sleepless nights, and I use this. It's like eating my own dog food. And I love this exercise. It helps me sleep better. And cognitive therapy for use in the NHS. For us, as a small company, we are a regulated medical device in the UK, class 1 medical device, and we have the initial clinical evidence to show that users are improving. So as a digital therapeutic, we have a really challenging path for a really small company, and the evidence base, what we have to collect. I have an evidence plan for 10 years, which is a lot, but we have started with real-world evidence, which means we are seeing 70% improvement rates in well-being outcomes in a matter of 4 weeks. So people start using our app, they download it on the Play Store, they start using our app, they get better, and then they leave the app because they don't need it anymore. And this we see the future of digital therapeutics. We don't need to keep people on the platform. We just need to get people in, make them better, and then they go back to their lives. We don't want to keep them eventually on the platform. And this is what eventually separates us from other apps who are engaging, entertaining, maybe Netflix style, but do not effectively treat the people. There are a lot of benefits we see which the NHS can use from digital therapeutics, but again, it's a massive challenge because the NHS and mental health as a whole is service-led, which means it's delivered still by clinicians, but we believe that technology has the scope so that we can put the people who have mild to moderate mental health issues, we can put some of them on technology and leave the clinicians to treat the people who really need the most care. And if we can get this model right over the next 10 years, yes, I know that's a really long time, but that's what it takes to commercialize in mental health. If we can really get this right in the NHS, then we can cut down backlogs, save costs, and yeah, of course, make some money in the process as well. So thank you very much. Happy to answer any questions. This is where you clap.
Any questions, Ravi? Let me get the other mic. Do you have the microphone?
Hi, thank you, Ravi. Yeah, I just wanted to ask, this sounds fascinating again from my perspective. I just wanted to ask about your feasibility study. You said you had a 120-person one going on. It was just to see if you could talk us through that a little bit more.
So we have a 120-person feasibility study in the UK, which is run by a charity called Talk Health. And again, we didn't find a single NHS partner, unfortunately. But hopefully I'll come back to that. But this 120-person feasibility study, 50% of them are diagnosed with generalized anxiety disorder. 50% of them have severe symptoms of stress, anxiety, burnout, but they're not diagnosed because they don't want to go to a clinician to be diagnosed. And the other 50% who do not have GAD have a lot of comorbidities like IBS, chronic pain, sexual health issues, etc., etc. And the study started in October. We have the initial results, and we are publishing it in January 2023 from the London South Bank University. And we're also starting an assessment with NICE, National Institute of Care and Excellence. We're on the early value assessment with NICE to potentially bring technologies to the patients. So this is an ambitious plan from NICE and NHS England, and we are eagerly looking at how we can work together with NHS England to bring digital therapeutics to UK.
Any other questions? So question, at the back. So question for me while we get to the back. How's your journey been as a startup?
Oh, I wouldn't recommend being an entrepreneur if you don't have, if you don't have the system in place. I've been incredibly privileged. I've got the resources, I've got the physical and the mental and the economical resources to pursue entrepreneurship. But it's incredibly challenging, especially something in digital health. I would recommend if you're selling phones, or if you're selling cars, if you're selling, I don't know, laptops, do that. But if you want to innovate in healthcare, any sort of healthcare, cardiology, mental health, bring with you 10 years of your life and bring everything in it, because otherwise you can't do that. You asked how my journey was. My journey has been purposeful. But I look at my colleagues who have done Oxford MBAs. I'm an Oxford MBA, and they're all in big banks, earning loads of money, and I'm here pitching. Again, if you're in a survival mode, never do entrepreneurship. And I wish this is what someone would have told me 3 years back. Now it's too late to turn back.
So one of the questions that I have is, looking through what you said, there seems to be specifically for anxiety disorders. And a thought that I've had is there are quite a few conditions where anxiety is quite comorbid for that. I was wondering if you were going to have, or ever thought of in the future, having more scope for those, so things like ADHD, autism, that kind of thing.
Yes, we're looking at comorbidities for sure. We're looking at 3 areas where anxiety has a severe comorbidity. Again, we're looking at the areas where we can make a regulated innovation within the next 1 year. 3 areas are really important. First thing is dermatology. Skin conditions have a huge correlation with anxiety. The second is chronic pain, which is a huge correlation. So most of the people who go to the GP with pain, many of them have anxiety. But the GP or the clinician gives them antidepressants and they manage the pain, but the anxiety is left unheard of. And these are the 2 conditions we are tackling right now. Not to mention the elephant in the room, which is cancer. It's obvious that when someone is diagnosed of cancer, they have severe anxiety, but they have to take care of their radiation, the chemo, of the treatment, etc., which leaves the mental health to a toss. So I'm hoping that some of you will build innovations in this massive space, addressing comorbidities, which is the correlation, the intersection of chronic physical and mental health, which you have rightly pointed out. So great question. Thank you for that.